My name is Madeline Wilson, and the topic that I chose to research was the undertreatment of chronic pain in people in the United States. Now, I have two pill bottles with me, and one of them represents the view on drugs that media and society have, and this pill bottle represents the view of drugs that people with chronic pain have. Now, both of these are very different because even though they could be exactly the same pill, what's inside of them can be viewed very differently by both parties. Now, starting with the way media views drugs, most people, when they think of drugs, they view it in a negative light, and they start thinking of addiction. Now, because the media can just focus on celebrities and criminals who have overdosed on drugs, addiction can be one of the first things that pops into someone's head when drugs are mentioned, because we're constantly focusing on how drugs are abused and not how they are helpful to society. So, overdose is one of the ways that people can view drugs. And overdose, drugs can often be related to overdose, which can lead to death. And so many people, when they think of drugs, they can think of they're just going to get addicted, overdose, and die. And that can cause many people with chronic pain to feel bad about taking pain medications and that they aren't supposed to do it because it's harmful to their bodies. And due to this negative way of viewing drugs, many people have thought of those who use drugs as druggies or hippies. Now, since this is a very negative way to view people who use drugs, it can make chronic pain sufferers feel very bad about themselves. Now, in this pill bottle that contains how chronic pain sufferers can view drugs, has a very different view on how they can help a human being. Starting with this, 50 to 75 million people suffer from moderate to severe chronic pain. So chronic pain in the United States is clearly an epidemic. Many people suffer from chronic pain from moderate to severe, and it can affect every single part of their daily lives. It can cause them to lose interest in their hobbies. It can cause them to be less productive at work. It can just overall decrease their quality of life. And yet, so many people don't know that there are so many people suffering from chronic pain because everybody is focused on how people abuse drugs and overdose. So a lot of that goes unnoticed. And sadly, only 25% of those with this kind of chronic pain are provided with sufficient treatment to control it. Now, because people fear addiction and overdose so much, doctors can start to fear it too and will not prescribe real painkillers that will help the patient because they're scared that they're going to get addicted and overdose and then die and get them in a lot of trouble. And because of this obsession on addiction and overdose, everybody is scared to prescribe medications to those who are actually suffering. And it's really sad to see that going on in the United States. Most of undertreated pain happens as a result of physicians' lack of knowledge on the subject of pain and how to treat it. So a lot of pain can be seen by a doctor. Like he can see if someone is in pain, but little doctors are actually taught on how to treat pain and how to monitor it and make sure that the pain is being treated effectively. And that's really sad because we are supposed to trust physicians and admire their knowledge of drugs and just respect them. But if they're not able to understand what to do when we have pain, then it's kind of disappointing to know that you could have chronic pain and not be treated for that because the doctor doesn't know what he's doing. No evidence exists that opioid users become addicts. Opioids are a kind of drug that can really help a person lessen their pain and really get over it and be able to overcome it and do daily activities that they couldn't do before. But because they're so addicted, people just focus that on addiction. They're not seeing that opioids don't typically cause people to become addicted and that there's no evidence for it at all. Poor physician training is one of the biggest factors that lead to untreated pain. Because of physicians' lack of knowledge of pain, just so much pain goes unnoticed and untreated, and it's really sad to see people who have to suffer every day because physicians weren't able to treat it or diagnose it or do anything about it. Undertreatment of pain happens all the time, yet most people are left to trust the authority of the physician to prescribe the right amount for their pain. Most people think that physicians are trying to help them get rid of their pain, but some of them are just so clouded by fear that they're not able to prescribe the right amount for the patient. And that's not helping them at all. And we're expected to respect the authority and just think that they have what's best in mind for us. But if all they're worrying about is overprescribing and getting people addicted, then I don't think that they're doing what's best for the patient. Many physicians can't tell the difference between an addict and someone struggling to find relief from their chronic pain. Many people with chronic pain will go from doctor to doctor trying to find pain relief and medicines that will actually help them. And this can sometimes be what addicts do too, to try to get drugs. And the difference is that people with chronic pain will tend to stop behaviors that are like addicts when they finally get their pain relief. But many doctors are unable to treat the pain effectively, so they don't know whether the person is just an addict or a chronic pain sufferer. And that's sad to know that those two are getting mixed up when they really shouldn't be. Last capsule. Not offering prescription pain medications can force the patient to search for more addictive and harmful drugs to relieve the pain. Because of the undertreatment of pain in chronic pain sufferers, many people are forced to go to more harmful drugs that actually relieve the pain, but do more harmful effects to their bodies and are more addictive, and they can actually do a lot of harm instead of just getting prescribed medications that should be prescribed from a doctor instead of being held back because of fear of overprescribing. And these two different views on pain medications are caused by media just having such an effect on the way people think. They think of drugs as being negative and leading to addiction and overdose and death. But nobody ever thinks of the people who actually need prescriptions and need help with their pain, that just it's hidden most of the time under all of the case files of people who have overdosed and died that are in the media, on websites and newspapers. It's sad to see so many people with chronic pain just being ignored because all people want to focus on is how drugs are bad for you and how you can get addicted and just die. It's really sad because lots of people suffer from chronic pain, but there's really little done about it.